A hand injury can really slow you down and keep you from enjoying activities. Because the hand and the wrists are such complex body parts, the Jacksonville Orthopedic Institute has therapists that specialize in treating them. And Joanna Starkey is a certified hand therapist. Thank you so much for being here, Joanna.
Thank you.
So let's talk about this and start off with exactly hand therapy. What is it that you're doing to help patients?
Hand therapy can be performed by either a physical therapist or an occupational therapist. And it's kind of a misnomer. Everyone thinks that we just treat the hands. We actually treat the hand, the wrist, the elbow, and the shoulder, especially most recently. And it kind of developed because the hand is very, very, very specialized and very complex. If you kind of put it in perspective, if you look at a map of the brain, if you look at all the nerves that control the sensation and the motor of the hand and the elbow and the shoulder, 2/3 of the brain are dedicated mainly just to the hand. So the surgery that's involved and the rehab that's involved, because the function and the feeling that's involved in this area gets a little bit more complicated than the standard physical therapy or occupational therapy.
Right.
So you're usually going to have someone who treats just this body part and is usually going to be a certified hand therapist, or at least working towards a certified hand therapist.
That's what you are, is a certified hand therapist. Talk about the training that goes into that.
So a certified hand therapist, again, can be a physical therapist or an occupational therapist, and it is governed by the American Society of Hand Therapists, and they have a very, very strict guideline on who can sit for this test. You have to have been out practicing in the field for 5 years so that you have the physical time-on experience. And then you have to have spent at least 4,000 hours logged in directly with hands. And then you have a written test. And unlike a lot of other specializations, this written test is much more comprehensive. It's a very advanced, skills and theories of hand therapy. And just to give an idea, the passing rate for the last 12 years for this test was less than 50%, or just at 50%.
Wow.
And then because you can't just take a test and then stay up to date, you have to meet certain requirements and recertify every 5 years so that everyone's up on what's new.
So what are some of the things that you're treating then as a certified hand therapist? What are some of the common cases that come through the door?
Common cases that come through the door are pretty much any injury that involves the shoulder, the wrist, the elbow, the hand. We can treat a broken bone, a torn ligament, a torn tendon, repaired nerves, but we also treat a lot of wear and tear, osteoarthritis. We see arthritis in the shoulder. We'll see them after surgery, before surgery, do a little bit of everything.
And you said one of the popular things amongst a lot of patients is getting the custom splinting.
The splinting, a lot of, especially, splinting can be a protection, or it can be something that helps replace a muscle that's missing, like this splints, like a dynamic splint that we make. If someone had a nerve that paralyzed these muscles, you can use essentially like a splint to kind of reproduce that muscle, and now it'll help lift the hand, the finger, which doesn't seem like that big a deal, but that same nerve usually takes out the wrist and those fingers, and they can't hold because they don't have the opposition.
Wow.
So if I put them in a position that holds them there, all of a sudden now they can pick up and write and button buttons and do.
Yeah, what a world of difference that must do.
So you can do something like that. A lot of people come, it's probably the most common splint we make. It's a little splint, takes me 10 minutes, and it just adds a little bit of support to the thumb. If you have arthritis in this joint, this splint will keep it from grinding and shearing, and all of a sudden you can grip, cut, and pinch again without pain.
Without pain being the key
Without
thing.
pain being the key word.
Yeah, because I know a lot of people come in and they just would like to get relief from their pain, and that's one of the things you guys do very well. And also you team up with JOI physicians as well. So how is that collaborative approach best helping patients?
That's probably one of the best things at JOI. All of the hand therapists spend at least a half day up with the surgeons while they're actually going to see each patient. So we get a chance to look at the x-rays, talk with the surgeon, because a broken finger is not a broken finger. Some you can tape, move, and tell them to go about their business. Others require complex surgeries with wires and things coming out of their hand that have to be held in a certain position. So it gives us a much better understanding, and we can really tailor and customize the treatment plan based on what the problem is.
If someone's watching right now and they would like to see someone such as yourself, a certified hand therapist, how can they call JOI and say, I want to see you, I want to see Joanna?
You can. For hand therapies, like any physical therapy, occupational therapy, you can come in off the street. but insurance isn't going to cover it. So usually you want to see a doctor to get a prescription.
Okay.
But you can certainly go to JOI's website, their Facebook, their Twitter page, or the American Society of Hand Therapists also keeps an up-to-date list of every certified hand therapist in the United States.
Get a referral, come in and see you.
Yes.
And the rest is history.
Yes.
All right. Well, thank you so much for being here.
My
We appreciate
pleasure.
you, Joanna. And thanks to the Jacksonville Orthopedic Institute for sponsoring this segment. You can learn more by visiting the website, joi.net, or you can call them. The number is there on your screen, 904-858-7045.